Welcome to today's nursing podcast. My name is Jennifer Scherze, and I will be your host and moderator. I'm very pleased to be joined by one of our highly esteemed authors, Dr. Carol Holtz. Her experience is very impressive. She recently retired from Kennesaw State University in Atlanta, Georgia, after holding the position of professor of nursing for 30 years. Dr. Holtz started her career as a nurse and has spent time treating patients in Mexico, as well as guest lecturing to students around the world in China, Egypt, and the Philippines. She's conducted HIV research, presented at the World AIDS Conference, and has served as a member of the Transcultural Nursing Society. Dr. Holtz currently serves as the elected vice chair of the Cobb County Board of Health. This fall, she's preparing for the publication of the fourth edition of her text, Global Healthcare Issues and Policies. What a timely topic. Welcome, Dr. Holtz. We're so pleased that you could join us today. Carol's going to talk a little bit about her experience as a clinical nurse, her experience as a nurse educator, and a little bit about what we can expect coming up in the fourth edition of her textbook, Global Healthcare, that will be publishing this fall. So Carol, welcome. I thought we would kick off today by asking you to tell us a little bit about yourself and how you began your career in nursing.
Okay, certainly. I have, in high school, I took an elective course in world geography. Perhaps that was the beginning of my interest in the world outside my own city. I decided that I wanted to work in the Peace Corps in Africa. Well, later on, I really didn't do that, but I kept my interest in health in other places in the world. I love science, and I decided to enter the University of Cincinnati College of Nursing. I got married, never entered the Peace Corps, but later had a career that focused on nursing in many other places in the world, nursing with different cultures and looking at different global healthcare aspects of world problems. I had a career in which I was a staff nurse for 5 years. I worked in Ohio at Cincinnati General Hospital. I worked in Atlanta, Georgia at Emory University Hospital and Grady Hospital. And then my husband was drafted and we went to Corpus Christi Naval Air Station in Corpus Christi, Texas. During that time in Texas, I had many opportunities to travel into Mexico. It was only a 2-hour drive. I worked as a staff nurse in the inner city hospital and found that I was working with patients who were better off if I spoke Spanish to them. So I brought a dictionary with me and did my nursing care. Later, I became one of the faculty at a college, Del Mar College there, and I taught students and who were Mexican Americans and patients who were Mexican Americans, and I saw that I was using Spanish every day in my practice. And that really were some of the seeds that got me interested in looking at nursing from a more global perspective. I later taught nursing at Kennesaw State University in Atlanta, Georgia, Greater Atlanta, Georgia, for 38 years. And I taught at the undergraduate, the master's, and the doctoral level during that time. I found that this really, my experiences in traveling and in learning about different cultures and my interest really sparked more interest in looking at health and healthcare issues that were more global and not necessarily right in my community.
Excellent. Well, you've had such an interesting career, and I really love how you've been able to tell us a little bit about how you, crafted your career toward global health and gaining a more global perspective. I also understand that you became a member of the Transcultural Nursing Society. Maybe you could talk a little bit about that and how that has helped shape your career over the years.
I'd be happy to. During my master's program, I went back to graduate school and I discovered the works of Dr. Madeline Leininger, who was a transcultural nursing theorist. And I based my master's thesis and later my doctoral dissertation on her theory of transcultural nursing. And that really was tremendously wonderful in my career. And I got to meet Dr. Leininger and got to be friends with her actually later. I later became an active member of the Transcultural Nursing Society, which is an international organization. During that time, I became associate editor of the Journal for Transcultural Nursing, and I was also among the 25 selected scholars, and I was in a group in which I could do research and jointly participate in many projects with people not only in the US, but in other countries. So that really gave me a tremendous base for which I could practice nursing and do many international endeavors.
That's fantastic. I understand that Dr. Leininger she's definitely an icon of transcultural nursing. And I know that we have some content that we publish in a few textbooks. So that's really fantastic that you were able to get to spend some time and get to know her.
It was wonderful.
It's always great when you can meet someone. That's fantastic. So you're a global health expert, and these days we find ourselves for many months in the midst of an unfortunate COVID-19 pandemic. And with the upcoming fourth edition of your global health textbook coming out this fall, how do you define global health in the context of nursing, and why is it so important, especially in the midst of a pandemic that likely this generation and many generations haven't seen?
Well, that's a great question. First of all, global health is a study, an area of study. It is a research and practice that places priority on improving health and healthcare and achieving equity for health for people of all places in the world. It's determined by problems, issues, and concerns that transcend national boundaries. These problems, issues, and concerns emphasize transnational health issues, determinants, and solutions. And the perfect example of a problem, as you mentioned, is the global pandemic of the COVID-19 virus, which is currently a world health issue and needs to be solved not by just one nation, but the cooperation of many countries throughout the world. It has influenced world health, including nutrition, disease, treatments, and there is a need for international cooperation in order to solve these problems. And we are certainly hopeful that a vaccine will soon be developed that will be shared worldwide.
That's very helpful. And I know that when we've chatted before, you've really emphasized the importance of nurses having a global perspective so that they can better provide patient care. And I'm sure that there's no better time like the present for nurses to really have that global perspective. Could you talk a little bit about the importance of nurses having that perspective and how they might gain that perspective if they haven't had the opportunity to travel to different cities or countries to provide care?
Absolutely. This is my favorite topic. The phrase, no man is an island, is true. What happens in one part of the world affects other parts of the world. And especially at this time, it can be very quick, as we know. A person can get on a plane in one part of the world and go to another part of the world very quickly, less than a day. And they can also be spreading diseases which they may be carrying with them. Let's see, in the late 80s, the Chernobyl accident caused many countries to experience high incidences of cancer and fetal mortalities. This was done because of air masses, rivers, and even oceans, which have no borders and transfer disease from one area to another. We have to care about health and healthcare of other nations in both developed and developing countries. And because we're all interrelated, people, crops, animals that are diseased can spread illness easily from one nation to another, such as Ebola, HIV, and we had contaminated beef a long time ago being transferred from one nation to another and causing diseases as well. Not everybody can travel. and either in the from a classroom or as an experienced nurse. And so there are ways in which people can learn a greater perspective of world health issues. Certainly students can take global health courses, or they can be embedded in courses that already exist. And also study abroad programs. And this is one of my favorite topics, by the way. I developed a study abroad program in Oaxaca, Mexico, which is kind of off the beaten track for people visiting Mexico. But I love the area because it had a lot of culture intact, and had the second highest infant mortality rate in all of Mexico, which very much attracted me. I wanted to find out what was going on in that area. I was invited to start a study abroad program in this area, and yearly for 22 years, I brought students to Oaxaca, Mexico in a nursing elective course, and the students lived individually with local families. They worked in the hospitals, which were part of the health department, the Centro de Salud. And we worked in a main intercity hospital and also a pediatric hospital, which was the only pediatric hospital in the whole state. And this was a wonderful example of learning about international health. And students and I, we all got wonderful experiences, including a number of publications from these events. Also, staff nurses don't always have the time or the money to go on excursions and go into places outside their own community, but there are also ways to learn more about health and healthcare in other places in the world. They can study foreign languages and use them with their patients. They can learn about transcultural nursing. They can take courses in international health. They can work in clinics for new immigrants and volunteer. They can participate in citywide health fairs, and there are many faith-based medical missions that don't cost anything that they can participate in. So there are really a lot of different ways in which staff nurses as well as students can participate and learn more about global health.
Those are fantastic recommendations. And that trip to Mexico with your students sounds very memorable. I'm sure that left a lasting impression on them, especially as they embarked on their career, and probably really opened their eyes to a new culture, new people, and a better way that they can prepare to provide patient care. Do you have any recommendations for maybe how to expand this in the classroom if there isn't a program set up to take students abroad? Anything that you could offer faculty to enrich their students in the classroom or virtually?
Well, they can incorporate concepts of international health within courses that already exist. And that may be the easiest way, because I don't know if all of them can add additional elective courses. But elective courses would be ideal for students to learn about transcultural nursing. The international health course that I developed would be an example. And I opened that course up to anyone on campus. We have 35,000 students on our campus, and I had students not only from nursing, but from other areas of study who were interested. And they studied the international health concepts and brought a different perspective to the healthcare arena, which I thought was very interesting. So we were mixed disciplines in the classroom. And again, they can participate, students can participate in health fairs. We have health fairs in our community in Atlanta, Georgia, that address the needs of Guatemalan people, that address the needs of Mexican people. They can get credit in their courses, and very often, and have these wonderful additional experiences as well.
That's fantastic. I love the idea of local health fairs in the community. I think that that's a great way for students to understand that when they are in the role of a nurse, that it's community outreach and understanding the population that they serve. going to switch gears a little bit. I know that you spent a little bit of time, and you might have touched on this briefly, researching HIV, and that you actually had the opportunity to present at the World AIDS Conference. How fantastic is that? Because I know that for many years that was really at the center of public health. So maybe you can tell our listeners a little bit about that experience.
This was one of the most wonderful experiences of my life, to be honest. Because I was working with my students in the health department, which is called the Centro de Salud in Oaxaca, Mexico. I had an opportunity to be invited by an organization called COSIDA, which is the HIV organization for Mexico, to conduct interviews in Spanish with HIV positive Zapotec Indians who were living in rural Oaxaca, Mexico. One of the reasons that they asked me to do it rather than a local person was because I was a foreigner. They believed that people would feel more confident in confiding with me and telling me their stories, which indeed they did. It worked out very well. Most of the women acquired the HIV from their husbands who worked in the US anywhere from 1 to 5 years. After their husbands returned home, the wives got pregnant, and the women discovered that they were HIV positive when they went to prenatal clinics and got tested. So this was a tragedy, really, but a way for them to at least be tested and having some treatments. As a result of one particular study that I did, the patients received federal government aid in getting psychological services from the Mexican government. So I was very, very happy that I could return something back to them as well as just taking information. I was able to present my research findings at 2 World AIDS conferences, one in Mexico City and another in Vienna, Austria. Also, my findings were published in the Journal for Nurses and AIDS Care. So I felt like this was a contribution that I could make and share with others and inspire others to get more involved in solving some of the issues with AIDS and nursing.
What a fantastic opportunity to be able to do that research and to be able to work with the population that, place their trust in you to present those findings. What an honor that must have been.
I agree. It was an honor. It really was. Yes.
And it really showcases, I think, many of the avenues that you can take your career in nursing as well, and that you have quite varied opportunities in front of you. So I think any students hearing this today who have an interest in travel and learning different cultures will be really encouraged that they have a really rich future ahead of them.
I hope so. Thank you.
You're welcome. So given the timing of the 4th edition and it's coming out this fall, were you able to incorporate any content pertaining to COVID-19 as you were compiling and creating the upcoming edition?
Yes, I was. As we all know at this time, COVID-19 information is evolving as we're speaking, and things change very rapidly. But I am currently chair of the Board of Health for my county, Cobb County in metropolitan Atlanta, Georgia. And the medical director of the Cobb County Health Department agreed to write a section about her experiences in coping with the COVID-19 virus. And her experiences really reflect a population of over 1 million people in our county and what is going on. But they do change. The stats change very rapidly. So what is written at one point may be a little different. And actually, at this time, as I'm speaking, things are actually a lot worse than they were when she wrote it. So it is changing. One of my students also participated in helping her, having dialogue with her and having experiences with COVID-19. So I think that it's really an evolving health issue today.
Definitely. I know that every day there's, new research either from the World Health Organization or the CDC. So that's definitely correct in that it's evolving and that we'll continue to learn more over the coming months. I
Yeah.
also understand that you have some exciting new coverage on Native Americans in this new fourth edition. This is, new content to the text. Could you tell me a little bit about that piece of content?
Yes, I'm very enthusiastic about this. This is just wonderful. I feel this is a great addition, and I don't think that this can be found in too many places. I have a former student who is now a doctorally prepared faculty member, who is a full-blooded Cherokee Indian, who wrote a chapter on Indian healthcare. And he did it from an insider perspective. He was raised on a reservation, currently does not live on one, but has family members who live on one. And he was able to get interviews with Native Americans and their experiences of what it was like to receive the health care from the Indian healthcare services, which I think is just amazing to get an insider perspective. And the chapter is beautifully written. So I'm excited for that to go out and see what the response is from others.
That definitely sounds like timely and interesting content. I know faculty will probably be very interested in that. And maybe you could talk to faculty a little bit about the updated chapter that's included on Chinese medicine, and then you have a new chapter on neurology. Just interested in how these are covered and why is it important from a nursing standpoint that nurses have an understanding of each of these topics for their practice?
Well, that's a wonderful question. Chinese medicine existed for thousands of years, really. For many people in the world, traditional Chinese medicine or some form of traditional medicine is still used today as their primary source of health and healthcare. In China, traditional medicine is the main form of medicine, and the alternative medicine is Western medicine. I had 3 different opportunities for 3 weeks each to visit mainland China and work with students in the healthcare facilities and also give lectures. And I got tours of the different traditional Chinese medicine hospitals, including ER, obstetrics, orthopedic surgery, amazingly all covered with traditional medicine. In addition, while I was in Nanjing, I took a 3-week course in traditional Chinese medicine, which does not make me an expert, but it gave me a wonderful overview of the topic itself. In many other parts of the world, traditional medicine, not necessarily Chinese traditional medicine, is used as a primary medicine, particularly in parts of Africa. And it's important to understand what this is about, what are the benefits, because it's existed a lot longer than Western medicine. Finding out what patients are using as far as medications and treatments, even though they're going to a Western style medical facility, because sometimes the medications contradict each other and can cause problems as well. I just find this to be a fascinating topic. The woman who wrote that section of the textbook, that chapter, is a physician who is from China, and she practiced traditional Chinese medicine in China, and she is now currently a member of our faculty at Kennesaw State University in Atlanta, Georgia. And she has a PhD as well. And she's got a fantastic background.
Those sound like such amazing experiences, having had the opportunity to visit China on several occasions, as well as have the opportunity to take the course that you did and to actually see an obstetrics and ER facility. Really, really fantastic. And I'm sure that you were able to incorporate those experiences into the text and into your teaching. So,
yeah, definitely. Yes. I bought the models in the bookstore and brought them right into my classroom when I came home. But it was in English, I have to say. I did not learn Chinese. Few words, that's all. Addressing the neurology chapter, which is brand new. This is a chapter that is probably quite unique because I have yet to find other textbooks that would incorporate the international perspective of neurological diseases and their treatments and health practices. And it's very important for people to understand, particularly in developing countries, what is it that people do to combat these neurological problems. And so this is a brand new chapter written by Dr. Noah Holtz, who happens to be my husband, a neurologist. And he agreed to write this, and he said he thoroughly enjoyed doing it as well, and feels that he can now connect and give some of his experiences and share them with other people.
That's great that you were able to collaborate with your husband on that piece of the textbook, and both two very important and timely topics and great content for this fourth edition. So if we talk a little bit about self-care, and how can people who are on the front lines fighting COVID-19, what are your recommendations for nurses and healthcare providers? As someone who has years of experience, what advice would you have for new graduates who might be faced with caring for patients with COVID-19, and, especially, I think, entering the nursing profession at this time? It probably takes some ramp up time going from the classroom and then caring for patients and being very hands-on all the time. And now you have the pandemic and the virus that you're also dealing with as well. What might be some advice that you would hand to them?
Well, this is the unique experience, unfortunately, a very difficult one. But as a former staff nurse with clinical experience, I would say that, of course, you have to be tested, and it's mandatory within hospitals and clinics, at least in Metro Atlanta, that every staff person is tested. You need to be very concerned about protecting your family. Most people are connected in some way to either spouses, children, parents, neighbors, and so on. And they have to take very good care of themselves and use the protective health gear and watch their general health. There have been many issues about inadequate health gear, protective health gear, and I think that's improving, but there's still a very serious concern about people protecting themselves and not giving it to their family members. I have in my immediate family a son, a daughter, and a daughter-in-law who are healthcare providers, 2 physicians and 1 nurse. And they also have children at home, and they are extremely cognizant of the need for staying protected and also for not giving, obviously, any problems to their family members, knowingly or not knowingly. They have to be tested, and they have to be very careful. And they are now very stressed out about not seeing the light at the end of the tunnel yet. Till we get some type of vaccine, they feel that they are still going to be very concerned about spreading the disease and giving it to someone else, and they would feel terrible about it. So they go into that environment and work and are very cognizant of all these factors.
Thank you for that perspective, Dr. Holtz. And you're a family of healthcare providers. That's really wonderful. And we, thank and applaud your family for all of the wonderful work that they're doing to care for those patients. And we hope that very soon there is a light at the end of the tunnel for sure.
I certainly hope so.
Right. We all do. We have a lot of great people working on a vaccine, so hopefully that's available sooner than later.
I hope so too.
So just in closing, I understand that you're an avid traveler and you enjoy new places, and you've said you love to be immersed in the culture. I'm just curious, when it's safe to travel and you can get back out there, what would be the next destination on your list?
Oh, that's a wonderful question. According to my 3 adult children, they always say that their mother likes to travel to a country where she can't speak the language, can't drink the water or eat the food, and has a wonderful time. And that is so true of me. That characterizes me. But there are many, I've traveled to many places in the world, but there certainly are more that I would like to go to in the future. And one is to go across Russia on the Trans-Siberian Railroad. Another, I would like to go to Galapagos. And another would be to go to Alaska and learn a little bit more about the Inuit natives there. So those are some of the adventures. For whatever reason, I don't seem to like to go as much to places where I'm very comfortable and can speak the language and eat the food. So that's just me. I'm off for an adventure.
Well, that's fantastic. And I know that your adventurous spirit has really helped shaped your career, has helped shape the content that you infuse into all of your textbooks. And your children know you very well, don't they?
They
And
all
those
live
destinations sound fantastic. And I'm sure that adventure awaits while you're there. Well, this wraps up our podcast for today. I'd like to extend a very warm thank you to Dr. Carol Holtz for spending some time with us, for detailing her career, her upcoming new edition, and talking a little bit about the current state of nursing. And you can find more podcasts on our YouTube channel, and that information will be available shortly. Thank you for joining us today.
And thank you for the opportunity. I've enjoyed
Thank,
it very much.
thank you. That concludes our podcast today. Thank you, Dr. Holtz, for your time and for inspiring all of us to think with a more global mindset. I want to remind all of our listeners that the 4th edition of Dr. Holtz's new text, Global Healthcare Issues and Policies, will be available for purchase or for faculty review copies on September 1st. Please visit go.jblearning.com/Holtz, 4E, that's HOLTZ, 4E, for more information. Thanks again.